Okay, welcome to Washington Exec's video series, where we talk to GovCon executives about the current trends and topic impacting industry. I'm Amanda Ziede, senior reporter with Washington Exec, and today I'm joined by Bruce Caswell, the president and CEO of Maximus. Thank you so much for joining us today, Bruce.
It's a pleasure. Thanks so much for having me.
Of course. So we've been tracking the impact of the coronavirus pandemic on government contracting, the industry, as well as its employees and people. And today we'll also be discussing the impact on the customer's mission. So Bruce, you lead a company specializing in government services with an international reach and a heavy focus on health and human service programs. And Maximus partners with federal, local, and state government levels. So I wanted to ask you first, how have you seen the needs or critical missions of new or existing customers change during this time?
That's a great question. First of all, I've been thrilled to see how essential, and it's really confirmatory. I mean, I've been at Maximus for over 15 years now, but it's confirmatory to see that the services we provide our government customers clearly are mission critical and essential in nature. Whether that's within the U.S. On health and human services space with the work we do administering Medicaid programs, or at the federal level, obviously with 1-800-MEDICARE, the Obamacare federal marketplaces, and so forth. And so there's been a great resilience of the business model just in that regard. And as a consequence, we've been able to, and we'll, I'm sure, get to this in further discussion, we've been really able to keep our operations, our critical operations going, even as we've pivoted the delivery model substantially to more of a work from home kind of hybridized model. That said, the customer needs have very much changed. And it goes without saying, two of the greatest areas where we've seen demand have been for assistance related to COVID-19 itself, whether it's initially standing up information lines to help triage calls and get consumers and get citizens the information they need, to supporting the testing process by taking on a very substantial contract to communicate test results to individuals as they come in from 47 federal testing centers, to more recently doing work in the contact tracing area, where we've announced recently the work we're doing for the state of Indiana, with many other states to follow as they undertake contact tracing as obviously a critical component in the next phase of opening up and reopening their economies. Another component of our work has also been to support our customers, unfortunately, having to deal with the massive unemployment situation we find ourselves in, with today the numbers, I think, saying that nationally more than 36 million Americans are looking for work or unemployed. And so the burden, obviously, on state employment systems has led to opportunities for the private sector to partner to help with benefit inquiry calls and even eligibility assistance for various states. And the good news is the customers are very open to a modified delivery model where, in many instances, the individuals that we're hiring will never have direct contact with. They come to us through hiring supply chain, ultimately, in many instances, bring their own equipment, work from home, are trained from home, and it's like a contactless contact center, if you think about it, right?
Mm-hmm. Yeah, are there any other specific ways in which your team has had to change the way it helps these customers in order to meet and support those needs?
Well, the area